to which the healthcare systems in some countries have fault lines, this crisis is likely to expose them. Some countries have been proactive in testing and treatment. The UAE, for example, tests roughly 20,000 people per day, it's using plasma treatments of recovered patients to mitigate some of the effects of the disease on patients that are infected. And they also have a program in place to deal with some of the mental health aspects of the COVID crisis, something that one of our panelists will be talking about today with respect to Iran. Other poorer countries in the region with large populations, Egypt for one, for example, overcrowded cities, are on the other side of that spectrum. This panel will look at the crisis in the individual states, but we will also address what I think is a very, very important topic, which is how this is affecting the broader region and what kinds of steps at the regional level in terms of cooperation will need to be put in place in order to deal with a virus that does not require a passport to travel. It does not honor boundaries. I'm honored to introduce our esteemed panelists. We first have Dr. Amir Afkhami, is a professor at George Washington University here in Washington, D.C., who has focused on mental health and psychiatric problems associated with the disease. Dr. Afkhami, I think we probably could all use your services right now during this crisis. And he's also going to be talking about the history of pandemics in Iran and the current state of healthcare in Iran. And then we're going to move to Dr. Amir Rois, professor of global health and epidemiology at George Mason University. She is an epidemiologist focused on infectious disease pandemics across the Middle East. And she's done some particular work, and she can amplify this comment during her talk with particular work in Egypt and in Jordan. And then we're going to move to, last but not least, to Omid Nekfarjam, is an award-winning journalist from Iran, but based in Prague for the last 13 years. He's an editor with Radio Farda, which is the Persian service of Radio Free Europe and Radio Free Liberty. The only announcement I'm going to make is that this is a virtual meeting, but I will be taking questions, audience questions, through the Zoom Q&A function, which you can all see on the bottom of your screens. For those calling in by phone or watching our panel on the live stream, you can ask a question on Twitter with at hashtag MEIEvents or email events@mei.edu. If you have any particular technical issues, please email events@mei.edu. Feel free to ask a question at any time throughout the panel. I will be doing my best to look at all of your questions and will factor as many as possible into the discussion. So I'm honored to be here with you today. Thank you for joining. And we're going to start with Dr. Afkhami. So roughly 3 to 5 minutes for each of you, please. And we'll start with you, Dr. Afkhami. Thank you.
Thank you. Thank you to the Middle East Institute for having me, and Professor Harrison for moderating. At George Washington University, I wear multiple hats. I teach at the medical school. I also teach at the School of Public Health. Amongst my scholarly work, I'm a historian or epidemiological historian. I was lately identified as such, and I will gladly accept that identity. I wrote a book entitled A Modern Contagion on the history of pandemic cholera in the 19th and 20th century Iran last year. And when I wrote this book, when it came out last year, I couldn't have imagined that we would be in the midst of a pandemic a year later. And I think in hindsight, I glibly stated at the end of my book that a century of intellectual secularization in hygiene, biomedicine, and associated public health practices had effectively ended the age of major contagions in Iran and for that matter in the rest of the Middle East, where non-communicable diseases had come to constitute the bulk of the disease burden. Of course, I think this was overly optimistic in hindsight. And in our current coronavirus pandemic, one thing that comes clearly across to a student of history and politics, as well as medicine, is how a combination of economic, political, and ideological motives in Iran, which has been the hardest hit country in this COVID pandemic in the Middle East, with currently about 78,000 confirmed cases and over 5,000 deaths, how these combination of economic, political, and ideological motives are responsible for the large-scale outbreak there and continue to play a role in how this disease has and will impact the Middle East as a whole. We now are well aware that Tehran's lack of transparency at the initial weeks of the disease, its unwillingness to take robust measures such as social distancing, quarantine, and it's putting politics ahead of public health probably played a large role in the explosion of the disease. For weeks now, I've argued that the numbers of afflicted and deaths that are being reported out of Tehran are significantly below what the actual number of afflicted by the coronavirus are. I was very gratified that the Islamic Republic's parliament in the headlines today, as of yesterday, confirmed what I've been talking about and what I've reported, that this sort of lack of transparency continues, and Iran will likely be a major repository and major source of the spread of the coronavirus to the region for the months to come. Now, we face specific barriers to care in the Middle East that will probably play a big role in the spread of this disease in the months to come. Access to soap and clean water is still lacking for millions of Middle Easterners. The UN reports up to 78 million in the Middle East do not have access to soap and clean water. These are sort of basics of hygiene that will limit transmission. But even more important than that is the role that this disease will play in affecting the significant refugee population in the region, the internally displaced population in the region, and how ultimately it will impact the socio-political upheavals in the region, not the least because of the economic impact of the disease. So I'll stop here and I will hand it off to my co-panelists for us to continue this discussion.
Before we do that, I'm going to ask just a quick follow-up question, and then we'll move to Amira. You mentioned that in your book, you in hindsight you were overly optimistic. What did you know? What new factors have emerged in terms of the politicization and this crisis being used as an ideological tool was not accounted for before? In other words, you mentioned that there's been a secularization in terms of medicine in Iran, which is a good thing. So is that good news going forward, that once the politics kind of settle down to the degree they will, that Iran has the capacity, the surge capacity to deal with the crisis if the politicians get out of the way? Is it good? Is there a good news element here, or is it all bad news going forward?
Well, let me say that there has been a secularization in the treatment of infectious diseases. Since mid-century, Iran has been a leader in the treatment of infectious diseases. As a matter of fact, the current coronavirus pandemic followed the same path as the Black Death to Iran and then to the rest of the world along the Silk Route from China. And in the 1950s, Iran's Pasteur Institute was instrumental in identifying non-rat vectors of the plague, marmots, and later on pioneering vaccines against rabies and bringing under control the El Tor cholera pandemic in 1965. So in the realm of infectious diseases, Iran had achieved world-class status. In other areas of medicine, and I point this out in my book, such as the epidemic of substance misuse in the country, ideology played a big role in public health policy. Now, currently what we're seeing in Iran is a militarization of the public health response, where Ayatollah Khamenei has moved the leadership of Iran's coronavirus response into the hands of the Revolutionary Guards and the chief of staff allied with him. And essentially this militarization, I feel, at least currently, is a significant barrier to effective response to this pandemic, mainly because of the infighting between the civilian healthcare sectors and the military healthcare sectors in the country at a time when you need a cohesive national public health policy in the country. And the policy is still, as we saw with the latest report from the parliament, still imbued with a significant lack of transparency and a significant amount of politicization of how the country diagnoses and how the country responds to the disease. Unless there's a turnaround in this policy where the leadership of the coronavirus response in Iran is handed back to the civilian sector, I unfortunately don't foresee things to improve in the coming months.
We have a quick question before we move to Amira from one of the audience members about to what degree the sanctions from the United States have tilted the balance, affected the capacity for Iran to respond, and also tilted the balance perhaps towards the Pasdaran, the IRGC that you spoke about.
If we want to talk about tertiary effects of sanctions, i.e., Iran's poor economic condition leading to it not wanting to limit trade with China, thereby facilitating the disease to come into Iran, or the broader social determinants of health that have been ongoing in the past, even before the coronavirus pandemic, sanctions have played a role, but I don't think the sanctions have played a direct role in either the growth of the pandemic in Iran or Iran's inability currently, or unwillingness, depending on how you want to look at it, to respond to the pandemic for several reasons. One is that as far as the authorities in Iran is concerned, they have no need for outside aid. They kicked out Doctors Without Borders who'd come in with mobile hospitals and ventilatory units saying, we don't need you. Iran claims that it needs financial help, yet it has direct, unrestricted access to billions of dollars in reserves. Research has been done by Patrick Clausen and former Treasury Department officials, and they published on this. So they have access to funds. They apparently at least claim they don't need any medical equipment or any medical help from the outside. I do believe one thing though. Iran, the sanctions could get in the way in the future of Iran having access to new technology and more efficient diagnostic, prophylactic, and treatment methodologies as they develop, because this is a rapidly developing field. Very soon we will have antimicrobials, which will work against this disease. I think in a year and a half, we'll have vaccination. And in that realm, in the future, I think the sanctions could play a role.
Just one quick clarifying question, if you could be quick with this.
Sure.
The report, you talk about lack of transparency. The Parliament report that you referred to, I believe, said the numbers are low because of a lack of testing, not a cover-up.
Sure.
Is that your view as well?
My view is, look, Iran got 500,000 test kits from China early on in the pandemic. Iran, as of 2 weeks ago, produces 80 to 90,000 test kits to diagnose the disease. It has produced so much test kits that it is offered to export the test kits to neighboring countries. So my question is, why aren't these test kits being fielded?
Okay. All right. Thank you. Amira?
Yes, thank you.
You have the stage.
Yeah, thank you, Professor Harrison and the Middle East Institute for hosting this important panel. As you mentioned, I'm an epidemiologist. I currently am a professor. And prior to that, I served as an outbreak investigator at the CDC. I have been working over the last 20 years or so on emerging infectious diseases. Those are diseases that spill over from animals to humans, like this SARS-CoV coronavirus number 2. I have an ongoing MERS coronavirus study. Most of my work is focused on trying to understand how these viruses emerge and once they're in the human population, how they move around from person to person and what interventions are useful to contain outbreaks and reduce human morbidity and mortality or deaths from these viruses. In the Middle East, I've worked on building and contributing to emerging infectious disease surveillance, and doing some local research and surveillance studies. There are a number of things that have happened in the Middle East over the last 7 years or so around MERS coronavirus. That is another coronavirus that emerged and really hit the Gulf particularly hard with hundreds of cases in Saudi Arabia and some neighboring countries, as well as a few exported outbreaks. There's a well-known one in South Korea that resulted in a few deaths and a large hospital-based outbreak. And so what MERS coronavirus ultimately ended up doing was providing the Gulf with an opportunity to build its pandemic infrastructure and its infectious disease infrastructure. And because of that, they are in a way better equipped to handling this COVID-19 pandemic than, say, countries in North Africa that have historically had less resources put towards their health infrastructure and have dealt with some pretty significant issues in terms of low resources to improve infrastructure and reduce infectious disease transmission, particularly in healthcare systems. So there is a lot of room for improvement in that regards. Across the region, there are some vulnerable populations that we're particularly concerned about in this pandemic setting, and those really include refugee populations. And in the Gulf, there's also the guest workers or the migrant populations that we're really concerned about as well, because both of these groups have limited healthcare access. And once they are affected by COVID-19, they tend to have worse health outcomes because their baseline health status is lower than the average citizen in the Gulf, for example. So meaning that a lot of guest workers have high levels of stress. A lot of refugees have high levels of stress. Maybe they're not getting adequate nutrition. And so that makes them more vulnerable to negative outcomes from the disease. So those are two populations that the Middle East is really going to have to keep an eye on and provide extra resources to help contain the outbreak. Another big issue throughout the world and in the Middle East is that there is a dearth in personal protective equipment for healthcare workers. And you know, we are seeing reports coming out of multiple countries in the Middle East and North Africa and in other parts of the world. Here in the US, we're having some significant issues with PPE. We have shortages. Healthcare workers across the world are being asked to reuse their masks and other equipment and disinfect them. And that is not an ideal setting because it puts healthcare workers at risk for both getting the infection and then transmitting it to patients. In parts of the Middle East, this has been an ongoing crisis for the last 3-4 decades. And there are many, many examples of hospital-acquired infections and outbreaks. For example, you know, in Egypt and in other parts of the region, it's not uncommon to hear about outbreaks of infectious diseases associated with dialysis treatment or other hospital procedures. And so these are things that we also have to be aware of when we're looking at the COVID-19 pandemic in the region. And then finally, there is a shortage of testing globally, and there is undercounting, you know, in most countries of the world, except for maybe a handful of countries in Europe and a handful of countries in Asia. And so this also hinders the response, because if we don't know what the actual number of cases are, and if we can't differentiate asymptomatic, that is, people who don't have infection or don't have symptoms and are transmitting it from those who do have symptoms, we're going to have a very hard time doing outbreak investigations, doing contact tracing, and really being able to control this outbreak.
Could you talk, thank you, Amira. Could you talk a little bit before we move to Omid about the particular state of healthcare system in countries that you've been working in? So you mentioned Egypt, but Egypt, I think yesterday when we talked, I think you mentioned Egypt and Jordan. Just give us a more granular sense of what the state of the healthcare system is and how it is most likely to fare in this stress test called COVID-19.
Yeah, so Jordan and Egypt are very different in a lot of regards, right? Jordan has a smaller population. They also have somewhat of a more robust healthcare system than Egypt in some regards. So what you're going to see is, as you're already seeing now, Jordan has been able to implement more stringent mechanisms to keep people at home. They have a stringent night curfew. Healthcare workers are under directives in terms of how to approach potential infected individuals. They've put in quite a bit of resources into containing the outbreak, but it's a very different environment than in Egypt, where you have a much larger population and larger city centers and quite a few underlying health infrastructure issues that remain to be in need of focus and resources to address those. So, in both countries, you have underreporting, as is everywhere in the world, really. But I think in Egypt, I worry more about underreporting because of the sheer volume of the population and the initial ongoing movement of people. I mean, now things have changed, and there is also a night curfew there, and movement has been limited significantly, but it's the early movement that we worry about with these outbreaks, because that's when the virus is first introduced in the population and moves around. And so those initial cases and initial outbreaks go undetected, and then what you end up facing is increased numbers of hospitalizations or deaths from respiratory conditions without being able to really link them to this coronavirus in particular. So testing and infrastructure, healthcare infrastructure building is needed in both areas, but there are some unique challenges to both areas. And even within the countries, there's some sub-regional needs that do also need to be addressed. So, in a way, there are some broad things that you can say at the regional level and at the country level, but really it takes going in at the sub-region and really addressing the healthcare infrastructure and health needs in order to control this outbreak.
So are you seeing any, particularly within the Arab world, any attempts to cooperate in terms of stemming, earlier we talked about migrant communities and IDPs. Are there any steps that you're seeing at the regional level of states cooperating in order to be able to fashion some kind of either a regional response or at least help each other in terms of fashioning a national response to this crisis? Or is kind of each country kind of coping with the stresses and the strains that this virus is confronting them with?
There's a combination of both happening. Over the last 20 years or so, the international health regulations have been implemented at a more broad level. And so that means that many countries have had the opportunity to review their outbreak response plans and review their surveillance systems and identify weaknesses that they then focus resources to improve. And so what that has done is it brought people together in the different regions of the world to get to know each other and to start working through their surveillance systems and their reporting to each other and to the world. So that has been a very important exercise that's happened over the last couple of decades. And this pandemic is, in a way, a test of how well the IHR exercises have been in really building some kind of an infrastructure. And it's clear that a lot more does need to be done. But at a minimum, we do now have regional conferences that bring together the surveillance teams from the various countries. And so that does help in the communication. And it's very clear, and I think most people in higher levels of government do understand that these viruses don't have any sort of, as you said earlier, there is no passport. They move freely around. And so it really does take a unified approach to surveillance and to reporting in order for all of us to really control the spread of this virus. And so that ongoing communication over surveillance is really critical, and reporting not just to your neighbors, but also to the global community is really critical, because as we've all seen, we were a highly mobile global world. And so what happens and what emerges within a month is all over the world. And so these conversations between countries and between your neighbors and globally are really critical to identifying these viruses early on and to containing the outbreak. The other thing that's very important for neighbors to do is to be aware of what's happening in the neighboring country, because that is often an indicator of what's to come in your country, or what's already happening that maybe you're not detecting by surveillance. So in the case of the outbreak in the Middle East, there were quite a few early outbreaks that were linked to movement of folks from hotspots like Iran. There were some outbreaks that started in an array of countries in the Middle East that were linked back to individuals traveling from Iran who were infected, or traveling from parts of Europe who were infected, went in, as a tour group, for example, in Egypt, and then you had some focal outbreaks happening. So that constant communication of surveillance data and of outbreak data is really critical to help countries be better prepared to respond.
Yeah, in the West, one of the things that we've seen is that even though the politicians may be playing the blame game, with Iran, with the United States, and in China, for example, many of the scientists in China were trained in the United States. Many of the Iranian scientists, I'm sure, at least the older ones, were trained in the United States. So, and I know that there is communication, at least on the China-US side, between the scientists, if not the politicians. So maybe we can a little bit later in the final minutes talk a bit about what needs to take place, both at the scientific community, the medical community, but also the political level, in order to stem this virus. What needs to be done at the regional level for that to happen. Thank you, Omid. Maybe you could spend the next 3 to 5 minutes with your opening comments. Thank you. Nice to have you from Prague.
Thank you. Thanks for the invitation. I'm no health expert. I'm mostly here to learn from my esteemed co-panelists, but I'm a journalist from Iran, and I know Iran. And what is concerning is what Dr. Afkhami called as a politicization and militarization of the response to COVID-19 in Iran. We have read many times in the last 4 months since the outbreak began that Iran, one of the biggest and richest Middle Eastern countries, completely botched its response to coronavirus. There are reports suggesting that the virus appeared in Iran around mid-January. However, the first official mention of the virus was in February 19, 2 days before the parliamentary elections. And when 2 people were reported dead in the city of Qom. In less than a week, 12 people were dead. Right now, the official statistics, as Dr. Afkhami said, stand at nearly 80,000 today, 80,000 cases of COVID-19, and almost 5,000 dead. But the other stats, including from the Parliament's Research Center report, it says as many as 750,000 people could have been infected, with the number of the dead almost twice that is reported now. This is while Iran is often said to have one of the very best healthcare systems in the region. So what happened? Iran's health ministry is run by respected doctors of medicine, from the minister himself down to his deputies, and the minister is the spokesman. They've made a huge effort to manage the crisis, to educate the people, to make the best of their meager budget, And they even managed to bring IRGC and Basij militias into line to help with whatever they can, from building mobile hospitals to turning barracks into makeshift medical centers, disinfecting the cities. Even though the IRGC often looks like it's showing off and it's using the opportunity to show off its ability and its reach in the country. So in Iran and some other countries in the region, like Iraq, you didn't talk about Tajikistan, Turkmenistan, Yemen, Syria especially. It seems that the problem lies elsewhere. The problem lies in the system of governance, in the lack of transparency and the independence, and the lack is imposed on the healthcare system, and also the problem is in the abundance of censorship. These make the people not trust the government, even when it comes to their health. Even when thousands of lives are endangered. So if I want to answer your questions for the today's panel, we can only hope that the biggest lesson of this pandemic for these countries will be trying to avoid politicizing their healthcare systems. That's the biggest thing that I'm just hoping that we can get out of this.
Let's hope we can do that in the United States as well. Going forward. I'm very careful not pointing fingers to other governments at this point, since politics does enter, it does merge with the healthcare risks in almost all countries, and our country here in the United States is no exception. We had a couple questions, Omid, and maybe you can either take this question or we can ask the other panelists about Turkey, and that is that number one, Turkey was slow to respond in terms of closing the Istanbul airport. And also that Turkey has shut off some water supplies to Syria, apparently, and which affects the ability for individuals to wash their hands, lack of soap, lack of water, and that could contribute to the spread of the virus in areas like particularly Syria, where Turkey is involved. So maybe if someone could comment, or Omid, you're welcome to do it, about Turkey. We've talked about Saudi Arabia, we talked about the Gulf a bit, we talked about Iran, Egypt, but we haven't talked about Turkey.
Mm-hmm. I can only give you a small point and then leave it to the other panelists. But the biggest thing that surprised everyone, especially in media, about Turkey was that apparently the coronavirus came very late to Turkey. Iran was entangled with the coronavirus. They had this huge issue with it, but nothing was happening in Turkey for a couple of months, I think. And then it was like, and the thing was, no one believed them. It was like nothing was happening there. There were no cases. There were no reported infections. Nothing. And then it just began slowly after a couple of months. That was very surprising for everyone.
Okay. Anybody else, Amir or Amira, want to talk about Turkey?
I think one of the important points to keep in mind is that we have very limited surveillance pre-COVID-19. On a good day, our surveillance system is what we call passive.
In Turkey, you're talking about? Where? In Turkey or broadly?
Broadly, across the world. And this is one of the big issues that we're going to have and that we do have right now with COVID-19. If we don't have active surveillance systems, it's very difficult to know when the first case actually shows up and when the outbreaks are actually playing up until we have testing and we do contact tracing. And so, we were also in the midst of a flu epidemic when coronavirus emerged. So it is quite possible that lots and lots of cases across the world, and particularly in the Middle East, went undetected or undetected as being coronavirus because there's a lot of times they present similarly. So I think this is also something that moving forward, or when the outbreak dissipates for a bit, we'll be able to go back and analyze some of the hospital data or surveillance data to understand, what percentage of the flu cases may actually have been coronavirus. And in a lot of countries, flu is reported just based on symptoms. There is no testing done. So that's something to keep in mind when you're trying to understand when did the initial cases first show up in the different countries.
There's a tendency for those of us to focus on the Middle East to kind of focus on the worst cases, the problems, right? And the reason for that, even on the political level, is you're more likely to be right than wrong if you're a pessimist, focusing on the worst cases. But I think it's important for this panel that we also kind of look at the full spectrum here in terms of where, if you were going to rank the countries and their responses to the COVID crisis, kind of how would you rank them? Who's doing the best job? I think either Amir or Amira, you mentioned the Gulf Arab countries.
Excuse me.
Yes.
Excuse me. Can I ask a question from Amira?
Well, yeah.
Good.
Let me just finish my question. Then
Sorry.
I'd be happy to do that. So whether we can take Omid's question, but I think sort of getting a ranking of what countries are doing the best, and then maybe that would take us into the area of what needs to take place if there are leaders in their responses. What kind of regional cooperation efforts need to be taken now in order to be able to stem this crisis? But in the meantime, Omid, feel free to ask your question.
I'm sorry, because my question is about Turkey. I just wanted to not to go over that. Sure. Is it possible for a country to be surrounded by countries all affected by the coronavirus and not show any signs? I mean, in the sense that it doesn't have any infection, because Turkey at some point insisted that there was no cases that should be reported. Is it possible for a country to be like that?
That is really unlikely, especially given how transmissible this virus is. The only way that would happen is if the borders were tightly closed and there was very limited to no movement of people from affected countries to the country in question. That's when you're looking at this virus and looking what's happening globally, that's the likely scenario.
Okay, thank you.
Amir, did you want to say something to that in response to Omid's question?
I want to go back to your question of sort of shining points in this whole sort of sad, tragic story. And there are enormous shining points. In the Iranian case, the shining points are the healthcare workers and the scientists who've done incredible work. I mean, some of the pioneering work in plasma treatment for coronavirus treatment comes out of Iran. But the other issues, sort of linking back to Turkey and its water issues with Syria, these are long-running political issues and goes back to the subject of politicizing public health, which Omid brought up, and the damage that politicization brings. And again, if we go back, history gives us a great example. In the region, and particularly in Iran, the battle against pandemics really shifted against pandemics and limiting pandemics when politics was removed from policy. Now, there's no absolutes in this. As you pointed out, in the United States, we certainly have politics, but we also have checks and balances. There's no absolutes, but the relative depoliticization of infectious disease response in Iran shifted Iran's ability to respond to pandemics. This was prominently displayed in 1964 when the El Tor pandemic of cholera made its way through the Indian subcontinent into Iran, and Iran rapidly responded, quarantining, starting a vaccination program that didn't spare members of the royal family or political figures. Across the border, the Soviet Union had to grapple with the same disease. Now, Iran largely brought the disease under control in a matter of months. Soviet Union, which had politicized its public health response was not able to bring the El Toro pandemic under control. This is an industrial superpower, was unable to control this disease for another 5 years, and the pandemic traveled all the way to Crimea 5 years later.
So if you're going to talk about that dichotomy of states that have a more of a clinical, more of a depoliticized response to pandemics.
And I have to say, relative is key, because there's no absolutes. There's always going to be politics and public health. There's always going to be, but it's about how much.
But if we take that dichotomy, states that respond in a way, more of a practical approach, more pragmatic approach, and those that respond more ideologically, how would we apply that to the current Middle East? In other words, going back to the question of sort of the shining spots, which countries, we've talked about Iran, we've talked about Egypt, we've talked about I made a comment about the UAE in my opening comments. We've got Israel in the mix, we've got other countries in the mix. If we were going to rank these countries on the scale that you've created, Amir, in terms of those countries that are taking a more of a pragmatic approach as opposed to a politicized approach, who would be the winners and who would be on the right side and who would be on the wrong side of that divide?
I'm gonna just say that's a difficult question to answer, because different countries in the Middle East are dealing with different burdens of the disease and have different populations, and it makes a difference from a public health perspective how you can respond. So coming up with sort of a ranking, I think, has too many fallacies. But I'll hand it to you, Amira, if you have sort of a better way of looking at this.
I agree with you, Amira. I don't think we can really rank countries' response right now to COVID-19, because they are in emergency situations and they're dealing with very different issues. And so the response has to be different for every country and every region within the country. There are, some great examples of things happening to control the outbreak within the different countries, and time will tell us and will give us a chance to look back and think through what were some of the more successful mechanisms that were put in place to, for example, reduce the risk of transmission within refugee camps. What were some examples of countries helping the neighboring country with surveillance, or sending PPE or something like that. So time will tell us about some of that. What we do see is that all over the world, the stay-at-home orders and the night curfews, the encouraging people to practice social distancing, those are really critical, and they are in a way, surprisingly, they're being followed in many countries across the world and in this region. So there are some great examples of people doing the best public health practice that they're being advised to do and really following those recommendations. And of course, you're going to see, examples where that's not possible, like in crowded settings, you won't be able to stay, 6 feet away from your neighbors because you're in a refugee camp and the housing is too close, right? So there is the flip side of some of the shining examples.
Thank you very much. Are you finding any of first of all, what is the degree, in your estimation, degree of international help coming from outside the region, from WHO and other organizations, in terms of helping ameliorate the problems on the ground, in particularly the hotspots of the Middle East, or the countries that are going to become hotspots in the Middle East? And number one, so what aid is being offered, and is it being internalized by the regimes that are receiving it? So to what degree, I guess the broad question is, to what degree is the international community playing a positive role in terms of suffocating this virus in the region? And that can be anybody, but I aim it first at Amira.
There are some examples of WHO sending teams to help scale up response efforts and testing efforts, and helping countries build their surveillance response specifically to COVID-19. A lot of the teams coming back from their missions have said that the varying countries in the region, are really doing their best and have made progress in trying to implement contact tracing and surveillance, and to use creative methods of triaging who should get tested, because we're in a situation where we have a limited number of tests. And so it has been good to see that there is some innovation happening in that space.
Have you seen anything? We had one of the audience members was asking about Yemen. Obviously, we know that the baseline humanitarian crisis going on in the country over the last 5 years, and even before that, is affecting, would affect the ability for whatever government authorities are, either the Houthis or the Hadi government, Hadi-led government, to respond. But do you have any more granular information about what is happening on the ground there? I haven't seen any reports of COVID cases, but again, that could be a reporting issue because of the lack of state structures. Do you have a sense of that?
Right, we're very concerned about Yemen because it has a very poor health baseline, and a lot of the population is susceptible for having terrible outcomes from COVID-19. But again, the limitation here is there's very few tests, and there's very little in terms of surveillance and reporting. So unfortunately, this is a country that could end up having the worst outcomes in the region.
Okay. In terms of, so maybe we could talk in going forward for the next number of minutes, a little bit about what needs to be put in place in order at the regional level. We've talked a little bit about that in terms of sharing information and so forth. Is there any other comments that need to be made about what needs to take place at the regional level to help both contain the spread of the virus in the region, but also in the individual countries? Mira, you've studied the history of pandemics. So I'm assuming that when you talked about Iran in the 1950s and 60s, Iran was a regional actor then. So maybe talk a little about to what degree we need to be thinking more regionally when we look at this COVID-19 crisis.
So infectious diseases don't know borders, So any response to infectious disease has to be regional, if not global, to be effective. Because sooner or later, if you don't address it across your borders, it will find its way back. In the 1960s, when Iran was grappling with the cholera pandemic, Iran's Pasteur Institute developed a vaccine against cholera that was 2 times more effective than its US counterpart. And the Islamic Republic loves this statement. I sort of said this in a BBC interview. They just cut out that statement and it's been on the website of the Ministry of Public Health. So Iran at that time developed this effective vaccine, not only developed enough for its own market, but actually exported thousands of doses of that vaccine to Syria in 1964, because Syria was the next country being hit by the disease. So there was a regional approach. Iran engaged with the WHO, engaged with the United States as a leader in the biomedical community to develop these therapeutics. I think regionally there has to be engagement going on, and I think there has been a rapprochement. If we look at UAE and Iran, for example, Iran offering to export test kits to the UAE and other Persian Gulf countries, this is a sign of rapprochement. That's sort of a biomedical rapprochement that's going. But we need more of that. We need transparency, which is something that has been absolutely lacking, and I stand by it, certainly in the country hardest hit in the region, which is Iran. We need to take security in terms of the military, industrial aspects, and the political aspects out of the management side of things. And I think in that setting, we will have better control over a contagious illness that does not recognize man-made boundaries.
Okay. So I'd like to take us to another area, and maybe we can bring Omid into this part of the conversation, and that is the political realm. One of the things we are worried about, or I've seen a number of analysts worried about, is Iraq right now, in particular, because it has shaky political fundamentals to begin with. It's also the venue for the U.S.-Iranian contest, and it's been struggling to form a government over the last number of weeks. And now all those effects will be amplified by the COVID-19 crisis. So I think one of the things that we want to end on is to what degree the COVID crisis to be a destabilizing factor politically, because that would redound negatively, if there is destabilization, on the healthcare capacity for these states to respond in the pragmatic way that each of you have talked about being required moving forward. So maybe, Omid, you could talk about the political side of this a bit, relating it back to the health piece, but talk about the politics of it. Iran, but also more broadly Iran, maybe Iraq and other countries in the region.
Yeah. Actually, this has been a big problem for Iran right now, because of the tensions in the region and the tension between Iran and the US, But as Dr. Afghani said, I think Iran has been is very capable of dealing with this problem without making it very political and trying to use it as a tool, to get the sanctions off his back, or to get more money inside the country, using the disease as a tool. But in Iraq, I think it's very, it's a very shaky ground, because Iran and America has made it, there is literally a proxy war going on there. They're just playing with fire in Iraq, and considering that there is no government, official government right now there, and they're just waiting to see what happens with the government, who can take the reins. I think this can be a very big problem for them, dealing with the disease.
Okay. Anybody else, either Amir or Amira, talk about state failure or state fragility as a irritant or exacerbating factor in terms of the spread of this virus? We have a number of failed states in the region. Syria at this point, Iraq is challenged, it's fragile. We talked about Yemen a bit. We've got Libya, something, country we haven't talked about. To the degree to which that's going to affect any kind of regional response to this crisis. I'll call on Amir.
Also, there is another point. Sorry. Yeah, there is another point, and this is I just look at the news reports, and I've never seen an example of these countries talking to each other about coronavirus and the pandemic and how they are dealing with it and what they should do together. Especially in the region. You talked about, I think Amira talked about the conversations, that it should be there. It's good to have a conversation with your neighbors about this. But I haven't seen any examples of it happening. Have you seen that? Because it is a pandemic. It is an international problem, and it should be solved by the international community. But especially in this region, in the Middle East, I don't see any international response. I don't need any regional response to the problem. Maybe it's me, but I usually try to look at this comprehensively, but I don't see any response.
So here's what we're going to do. Mara, why don't you answer that? Mara, you can answer that question, and then in the last 5 minutes, maybe I can give each of you kind of a little platform for a minute or maybe a minute and a half of sort of concluding comments, because we do have to end at 11 o'clock. Amir, do you want to answer Amit's question about the regional cooperation piece?
Sorry, Amir or Amira?
I'm sorry, Amira.
Okay, sorry. What you typically see in terms of communication between countries is you have the scientists and the responders who are working, and they're keeping their heads down, and they're trying their best to respond, and they talk to each other. They talk to their counterparts in different countries. There are several programs, training programs across the world. Some of them have been, scrapped in the last few years, but those programs brought together epidemiologists from across the world, trained them together, and then everyone, went back home and continued to work and serve as leaders in public health in their countries. And so these classes, really bring together lasting relationships and have been critical in encouraging conversations and information sharing and, technology sharing, therapeutic information sharing at the, lowest levels in government. And those have been critical, to sort of move response forward. And a lot more of that really has to be done, because on the other end of that spectrum, you do have the political leaders and the ministers who are also having their conversations, and they're being informed by the folks towards the bottom of that chain who are closer to the ground, right? So you have those two, broad sets of parallel conversations happening. And as this outbreak unfolds, we'll be learning more about what those binational conversations were like at the different levels, and what kind of an impact they had on the response to the pandemic. And I do think that we need to really step back and look at how we can improve those kinds of programs that bring people together at various stages of their careers and really build cohesive partnerships, because those are critical. They have been critical in our response to so many other health crises in the past, and they're critical right now as well.
Okay, I'd like to give each of you a minute or so. We have about 4 minutes left. Amir, do you want to start? We'll start in the same order we started at the beginning. Maybe Amir, you can make a closing statement of some sort. What do you think we haven't talked about yet that needs to be said?
I want to build on what Amira mentioned, in that I think this public health diplomacy, particularly non-state professional public health diplomacy, is a venue whereby we can save lives, reduce the impact of this pandemic regionally and globally, and also create a new venue of engagement that will bypass the barriers, both domestically and internationally, to regional and international collaboration. So it behooves us, it behooves Washington, certainly as our government, to really facilitate those conversations. They're low risk. There's very little of this can be diverted to nefarious means. So we have to open this up. And if there are barriers on the other side, it can be bypassed.
Okay, thank you. Hamid?
Omid, you said?
Omid, I'm sorry,
that's sorry. That's a great point, and I think there's a lesson for the Iranian officials there, because if they continue to imprison dual nationals, most of them university people, very, among them scientists, university professors, going back to Iran, they are dual nationals. And when they see the obstacles, when they see that there's a problem that they might be imprisoned and be charged with, fake accusations like espionage and whatnot, that will be, and in a situation like this, in a situation like a pandemic, they'll know that they are just making them flee out of the country and not ever go back, So if they don't do this thing, maybe it will be a good point for them if another thing like this happens.
Okay, thank you. Amira, 30 seconds. Closing comment.
I think if at the end of the day, we can come out of this with more robust surveillance systems and regional cooperation and global cooperation around disease reporting, we would be in a much better position to deal with the next large-scale infectious disease outbreak. And the reality is we are going to have another one, and we are going to have other important emergencies that are going to affect all of us. And so that is the one thing that I really do hope comes out of this.
Thank you. I just want to end, first of all, just make one closing comment, and that is that one of the things that struck me, somebody in their mid-60s, having experienced, a number of different events around the globe, the end of the Cold War, post Second World War, is that most events affect part of the globe, but they don't affect the entire globe. And one of the things about this event is it affects all of us as human beings. And I think going forward in terms of our responses and in terms of our thinking about solutions, I think that sort of level, the fact that this sort of levels us all in a way, is something that we need to all keep in mind. First of all, I want to thank each of you. You made the moderator's job very easy because you probed each other as well, and were not reluctant at all to speak out. I think you each provided your own different perspectives. We talked about many of the different countries, and we also, as I mentioned at the outset, we wanted to talk about the broader region. So I want to thank each of you, and I want to thank the almost 100 participants that are out there or were out there at the beginning of this event for dialing in during a very, very difficult time. Thank you very much on behalf of the Middle East Institute, and have a great day. Thank you.
Thank
Thank
you.
you.
Thank you.